Hi, greetings, students. This is Dr. Brown. I'm just trying to give some feedback. I got a question where somebody was asking they needed some clarification when looking at the organ systems. What happens in terms of how do you read this chart? So I want to provide some clarity. So on this side, sympathetic, this is like an agonist. So whether it's an alpha agonist, a beta agonist, when I'm in this column, I'm looking at the action of an agonist. When I'm on this side, I'm looking at the action of an antagonist. So this is like an alpha agonist, beta agonist. This is, you know, alpha and beta antagonist. So we're going to talk about a few organ systems. We're going to talk about glaucoma, so the eye. In the syringe, talk about the heart with blood pressure. Also, we're going to talk about BPH coming up in a few weeks, and we're going to talk about asthma. So I'll try to give a few quick examples. So I'm going to look at the eye, and this is talking about the eye and the receptor. It has some alpha receptors. So I'm going to use a database called Lexicon, which you have through the FAMU libraries. Go to the FAMU libraries homepage, pharmacy.famu.edu. Go to the very bottom of the libraries, and then you can click pharmacy. Pharmacy takes you over here to Lexicon. So I am going to type in phenylephrine. And I know that phenylephrine in terms of its mechanism of action. I'm going to do the ophthalmic since we're talking about the eye. And this says that it is an alpha adrenergic agonist. So this guy is an agonist for the alpha receptors. So in terms of its action, if we keep going down, all right. So we're going to come back over to this screen, and it said that using an alpha agonist over here is going to cause mydriasis, right? So this means that the eye is being opened wider. So I'm trying to look back at the indications. I was trying to give you some specific situations where we'll use it. Like sometimes if you're at the doctor's appointment and they want to dilate your eyes, they can use an agent like this because it's going to make them be able to have better access. So they can dilate your eye with an agent like this. And I want to show you where it's going to be used in a few other places. So this is the ophthalmic version, but we will not stick to ophthalmic. What we would do is we will go to phenylephrine systemic. In phenylephrine systemic, you see it's being used as a nasal decongestant. So in another place in the body, it's causing constriction. It's causing constriction in the blood vessels. If we come down here, so now that we're talking about blood vessels in your nose, alpha is causing constriction. So you need to understand that alpha is causing constriction in blood vessels, but in the eye, it's causing you to have dilated vessels. When you look at alpha in terms of the heart, so if we talk about an agent that's an alpha blocker or an alpha antagonist or agonist, how does it work? Okay, I'm going to move over to this side, parasympathetic, where we say blocker. So I see for the eye, ciliary muscle, and in terms of what's happening, I see secretion. Well, you can look at an agent like timolol, and the action of timolol ophthalmic is, this is a beta blocker, non-selective beta blocker. It's used in glaucoma, which we'll talk about in a few weeks, and this is going to increase the flow of aqueous humor out of your eye, aqueous humor. So looking over here, secretion, I'm now able to get a little bit more aqueous humor out. It can decrease the pressure in my eye because it's being filtered out, or it's being out. So that's beta for timolol. But now when I look at a beta blocker, I'm still on the side of beta. What else can a beta blocker cause? It can cause a decrease in heart rate. It can cause these different effects. So where may I see other beta blockers? This was Timolol ophthalmic, but I can bet you when we look at some of the adverse effects from it, so this is going to be local in the eye. More than 10% of this is just happening in the eye. Sometimes you can have cardiovascular effects other place in your body. Okay, so bradycardia. Looking back at my chart, I can have a decreased heart rate. So although its formulation is for the eye, every now and then, you may have an issue with your heart rate, but the principle is to know that in the eye it's going to secrete, but then in the heart it's going to decrease. I'm going to flip back over to the other side for the heart, and we're going to talk about those beta agents. So let's look at a drug called metoprolol. Let's see what metoprolol does. So metoprolol, in terms of its mechanism of action, it's a beta blocker, beta 1 selective. So beta blocker, when we talk about the subtype for the heart, which one is greater? Beta 1 shows up better than beta 2 in the heart. This greater than right here means that in this organ, in all of these parts, beta 1 is more prevalent than beta 2 is. So that's why we said that metoprolol, a beta blocker, has more of a beta 1 selectivity than it does for beta 2. And metoprolol and these other agents are going to decrease our heart rate and do all of the things that we're seeing here, right? So that's what's happening for a beta blocker. When we flip over and we look at an agent that could be a beta agonist on this side, we can take something like albuterol. Long-acting beta agonists are some of the drugs that we're going to be using in terms of asthma and COPD. This is a beta agonist, albuterol. But where does it act? Does it act in the heart? No. It acts down here in the lungs. What happens when you have on this side an agonist? Remember, agonist over here, antagonist over here. What happens when you have a beta agonist? You're going to have relaxation. So now the person can breathe better because the beta receptors in the lungs have been innervated, okay, by a beta agonist. And we saw here beta 2. This is why we said beta 2. A beta 2 agonist causes some relaxation. So basically what you need to learn and understand in this chart is what happens for beta in the lung. Beta relaxes the lung. Okay, let me come up here to the blood vessels. What happens with alpha and beta agonists in blood vessels? They're going to cause constriction. Okay, what happens to a beta, we want to say a beta blocker in the heart? You're going to come over to this side for heart, decrease heart rate. What about a beta agonist like albuterol? Increase heart rate. So we're going to test my theory, and I'm going to see for a beta agonist like that albuterol that we just pulled up, if we may get some of these symptoms as adverse effects. Let me say that again. We're talking about a beta agonist on this left side, antagonist on this other side. So if I want to use a beta agonist over here, I want to use a beta agonist which help my lungs out, but as an adverse effect, maybe it's going to affect some of these different places over here. So we'll go to the adverse effects that we may experience, and what do you know? Tachycardia shows up. So I can have some symptoms that are going to relate to the receptor. So what we need you guys to have a firm foundation of over here for the eye. What happens to an alpha or beta agonist, alpha or beta antagonist? For the heart, what happens with an alpha agonist? There are going to be some drugs that we're going to use when we talk about hypertension. They're going to be alpha receptor blockers, and alpha receptor blockers are going to help us out. Okay, so with blood vessels, if I use phenylephrine in my nose, it causes constriction. If I use phenylephrine in terms of I could use it in my eye, I could use it in my nose, but how do the different organ systems? The last example that I'll give you, we're going to be talking about the urinary bladder when we talk about BPH. So for the bladder, what happens with alpha? We're going to be talking about alpha 1 receptor antagonist and agonist, right? So contraction happens in my bladder. Contraction happens in my bladder from alpha 1 agents, okay? So I'm going to have relaxation for an antagonist. So depending on the disease state that you're looking at, we're going to have different agents that work. So I'm going to use, an agent like an alpha blocker. I can say tamsulosin. So what an alpha blocker is going to do is it's going to relax my sphincter. Okay? So how do the alpha receptors work in the bladder? Contraction, and then for the antagonist is going to work on the other side. So key places that we're going to talk about the first few weeks of class, we're talking about the lungs, we're talking about the eyes with glaucoma, we're talking about the bladder. Okay, so over at the bladder, glaucoma, and asthma COPD, you're going to need to definitely have a firm understanding of what's happening in the bladder, what's happening in the eyes with glaucoma, and what's happening in the lungs in reference to asthma and COPD. I hope that this provided some clarity. Thanks.